Thank you, everyone, for joining us. Today, we are going to discuss what causes migraines, right? What causes them? And what should you actually do to start getting help and answers? First, let's go back to some of the basics. Who's even impacted by migraines? Well, when you look at some of the data, it suggests that 1 in 4 households in America has someone who suffers with migraines. We also know that females tend to suffer with migraines more than males. So, this is a really, really big issue. And it prevents you from enjoying your daily life. Maybe it's hobbies, maybe it's work, maybe it's going to activities with your kids, maybe it's vacations. Those that have chronic migraines are always worried about when is the next one going to happen. And it's a really big hindrance on their life. And so we're going to go into the weeds, though, to help you understand what truly happens with migraines. Okay. Because once again, there's a lot of people that are struggling and they need help. They've done all the basics that they can think of, right? They've taken Tylenol. They then tried ibuprofen. They've tried Excedrin migraine. They even went to their doctor and did Imitrex or another triptan. And they either don't want any more medications or they're even doing the new ones, the CGRP, so the calcitonin gene related peptide. And it's still not fully helping. And it's because when we look at migraines, okay, migraines, let's just establish this. It's not one cause or trigger. Some people, you know what, they're lucky enough it is. But for a lot of people, there's not. There's just not one cause or trigger that makes all of the migraine. So, what are things that we should be considering? So, we're going to go back and when we look at migraines, let's understand that migraines, they impact which organ in the body is impacted when you have a migraine. It's the brain. The brain is impacted when you have migraine. Now, there's a variety of different mechanisms of how this happens. We know it can be vascular. We know it can be inflammatory. Okay. Those are two of the really, really big ones that drive migraines, both vascular and inflammatory causes and triggers. Okay, so when we look at migraines, right, we know brain, without the brain, there's no migraine. Now, there's different mechanisms. There's vascular. A lot of medications were made for this. There's also inflammatory. That's why people are doing ibuprofen. That's why they're doing CGRP, right? They're trying to impact the inflammation, but they're also trying to impact the vascular system, vasodilation versus constriction. And they're trying to get a good balance in that. So, and we're not necessarily going to dive into the weeds in that side because there ultimately is, right, the inflammation, abnormal functionality, and everything else. But what I want to go into first is I'm going to share my screen. So when we look at this, okay, this is altered immunity and migraine, a comprehensive scoping review. Now, we're not going to go through all of it, but we are going to just look at some of the results. So this is the immune side of migraines. Now, what they found was we found studies reporting elevated levels of some pro-inflammatory cytokines. So cytokines are chemical signaling molecules. So increase pro-inflammatory, such as interleukin 6 and tumor necrosis factor alpha. But then on the anti-inflammatory, one was increased, another one was decreased. But then what they note down in the bottom is changes in cellular immunity, including increase in T helper cells and decrease cytotoxic T cells. Now, really, this is going to be best served in a whole nother live stream. But when we look at T helper cells, so I've had a lot of people come in lately and they had a lymphocyte panel done through a regular lab. Maybe it was LabCorp, maybe it was Quest. And they ultimately report CD4, so these are your helpers, and then CD8, these are your cytotoxic. Okay. They will get those and they will get ratios. And I'm like, oh, well, your cytotoxic looks good. You know, what they're saying in migraine, so it may actually be a little bit less. And then with T helpers, that's actually increased. Now, we need to understand that the helper doesn't mean a lot with a standard panel. And let me explain to you why. So as it becomes a helper cell, there are different helper cells. You've got Th1 helper cells. You've got Th2. You've got Th9. You have Th17. And really the list goes on and on and on. So if we're looking at CD4 helper cells and it says it's elevated, well, why is it elevated? Now, I don't have a lab that actually does Th9, but I do run panels on patients where we break down their Th1, Th2 versus Th17. This lets us know what a likely culprit is and a causative factor. Because without knowing that, we're really just throwing things and hoping it sticks. Because one of these is for killing stuff, one of these is more for allergens, and then the other one, right? Acute infections, but also autoimmunity and tissue destruction. And once again, we'll cover this more in detail in another one. But I wanted to go into basically there is a big role in the immune system. And then lastly, just to cover this one a little bit more, is what you see. However, right, they say right here, a significant comorbidity of autoimmune and allergic diseases with migraine was observed. So when someone's dealing with migraines, it's super important that we understand what's happening in the immune system, what's driving immune system function. Are we inflammatory? Are we allergic? Is there a prior history of autoimmune disease? How well is that even being controlled? Because taking levothyroxine for Hashimoto's, which is the most common thyroid autoimmunity, is not controlling the autoimmunity. It's just kind of, it's allowing you to function better, but it doesn't do anything to truly change the immune response. So that's this one, okay? So at this point in time, we've said, hey, we know that migraines have migraines have a vascular component because vascular component. They have an inflammatory component. Now, what we're going to look at here is just one of the models that they've got for migraines. Ultimately, migraines impacts your vascular system, impacts your brain, right, through what's called your trigeminal pathway. And then what you'll see is they talk about regular lifestyle behavior. So lifestyle plays a role in how you're going to function. So the better your lifestyle, the less likely you are to have migraines. The worse the lifestyle, more likely you are to have it, because your lifestyle changes how your genetics behave. So it's what's called epigenetics. Now, what are some of the things you can do for migraines? Okay. We're not going to necessarily go into all the mechanisms of migraine. We will a little bit, though, as we cover some of this. So the very first one we have is magnesium. magnesium and migraines. So ultimately, normal magnesium, things are good, less likely to have migraines. Low magnesium in the brain, more likely to have issues. Now, I'm going to step back and explain what happens here and what the thought is. And for anyone wondering, when they look at the migraine research, they're typically supplementing about 400 milligrams of magnesium a day. Now, someone may need more. So when we look at migraines and magnesium, sometimes people need more than 400 milligrams a day. But magnesium is what's widely looked at. Now, why is magnesium widely looked at with migraines? Well, on your neurons, you have a receptor. Okay. This receptor is known as the NMDA receptor. It controls the flow of calcium into the neuron to cause it to fire or not. Now, this plug here in the middle, this is actually magnesium. So that's the thought behind giving magnesium is you stabilize NMDA receptors. Because if you don't stabilize NMDA receptors, you get excess firing of it. Excess firing leads to decreased energy because you burn through it. This leads to decreased mitochondrial function, which leads to oxidative stress, aka oxidative stress is going to drive inflammation, and that's going to keep this whole thing going and going and going. Now, the thing is, you really need to do magnesium more preventatively. Okay. It may not be strong enough to just pound it when you've got an active migraine. So always keep that in consideration. All right. So next, well, since we know inflammation and the immune system plays a role in migraines, people often wonder about essential fatty acids, right? Fish, salmon, fish oils. Is there stuff for it or not? Well, what does the research show? Now, when we look at the research is mixed on this. Okay. And I think there's a few reasons why it is mixed. So, but we'll get to that in a moment. But basically, dietary alterations of N3 and N6. So, N3 is going to be your omegas. So, that's what you're getting your EPA and DHA. Now, what they found was those that did 6 or 3, okay, ultimately have less headaches compared to those that did not. So that's one thing. And then here, this is a research article, neuroimmunological effects of omega-3 fatty acids on migraine. And here's a graphic from there, and it shows you what's going on. And then I'll explain what I think really should be done if you want to do omegas as a way to help with this. But when we look at these omega-3 polyunsaturated fatty acids, okay, let's start on the top. Omega-3 ultimately creates pro-resolving mediators, SPM, so resolvins, protectins, and myrisins. Now, it's important to note that if you have too much inflammation, you actually cannot convert your EPA and DHA into their specialized pro-resolving mediators. So you may not be getting the full benefit there. Next, we know these play a role in reducing inflammation and nociception. And right there, it shows you what it does with the cytokines. We said migraines ultimately have mitochondrial dysfunction, right? That's why people were trying to use magnesium, is to stabilize that. Okay. And then ultimately, there's some antidepressant and anxiolytic effects due to what omega-3s do within the brain. So lots of really cool stuff. Now, let's go back and answer that question. Well, you said the results are really mixed. Yes, the results are mixed because when we look at the studies, they're typically just giving people supplements and they're saying, hey, here's your supplement, here's what you're going to do. Now, the question mark we always have whenever we look at the nutrition research, and it's super important to be nuanced about this, is you need to have lab testing done before you really start supplementing with fish oils if you're trying to do it for migraines or other things and to make sure you're where you need to be. Because you can get what's done is called an omega check. So this is a blood test, omega check, and it's going to break down your omega 3s and omega 6. Okay. And it's actually going to tell you what your breakdown is of your omega 3s, your EPA compared to DHA to DPA. And then it's going to break down the different types of omega 6. And then it's going to give you a ratio, right? Now, a healthy ratio really is about a 4-to-1, maybe even a 3-to-1 of your 6-to-3. You should have more 3. I'm sorry, you should have more 6 than 3. But that's a healthy ratio. Now, when you get your omega check for the omega 3 side, typical labs are going to tell you normal is anything greater than about 5, maybe 5.5. Well, honestly, probably should be better than that. Probably should be shooting for an 8. But now imagine you're giving people supplements and you're saying, hey, let's supplement with essential fatty acids. But we've never pre-checked you to see where you were at to begin with. And when we finished the study, we didn't check you to see how well your levels truly improved. Because I can give 20 different people 2 grams of a fish oil. And at the end of 2 months, the way they absorb it is going to be different from one person to the next. And that's before we talk about converting EPA, DHA into those pro-resolvins. So I hope you're getting kind of the point here is that fish oils can be beneficial, but also we really do need to increase the type of research that's being done because it does leave a lot to be desired. And then, as we've previously talked about mitochondrial dysfunction with this, let's go back and look at some of the research. Now, there's some nutrients that really do play a big role in helping protect and stabilize the mitochondria. So this was a study that looked at the effects of using N-acetylcysteine. Okay, this is a precursor to glutathione, which is an antioxidant. Vitamin E and vitamin C also do play a role with antioxidant. Now, what they found was basically, hey, those that did this had reduction in headaches and migraines compared to those that didn't. Now, this was not a big study, but it was something where they did it and they found, look, these are people who are having anywhere from 2 to 8 migraines per month for at least a year. So it wasn't like new onset migraines and they just got lucky. So that's cool, right? Now, there's something else that also does play a role in helping the mitochondria and helping with oxidative stress, which we've talked about. And here it is, selenium. Cool, right? So selenium supplement may be considered a complementary therapy in patients with migraines due to its beneficial effect on oxidative stress and migraine symptoms. Now, this is really cool because selenium, it's actually a really cheap supplement, okay? So yes, there's supplements that cost more, but selenium is a really cheap one. So at this point in time, we've said we've got magnesium, we've got fish oils, which looks promising. We've got N-acetylcysteine with vitamin C and E combined. And then we also have selenium acts as a way to do it. Now, maybe you're like, but, I really don't want to spend money on a lot of supplements. What can I do? Right? Well, this whole next part is for you because this is where we really start getting into the nutrition, diet, and lifestyle component. So it's super important that, once again, as we look at migraines are a neurological based issue, okay? I'm just saying brain, through vascular and then inflammation or immune. Inflammation in the body. So if we put here body inflammation can drive brain inflammation, right? Because everything's connected. And so inflammation in the body can drive stuff there. Now, one of the most common places for inflammation in the body is going to be the gut. That's why when people's guts are off, they get all sorts of different stuff. So let's look and see what some of the research is showing. Now, here's a research article, okay? And ultimately, it's looking at when you're getting proper dietary fibers compared to not. So this is really just keeping the bar really, really low. It's basically saying, please just stop going to McDonald's and, the fast food places. Like, can we just slow that down for a bit? So on one side, you see you got pizza, you got hamburgers. Now, not all hamburgers are bad. Do grass-fed beef, and you may have to, switch out the breads. But, that's a good place to start. Ultimately, though, this causes gut dysbiosis, so an imbalance of your bacteria, which we see here. And we see what happens, right? You decrease the beneficial bacteria, you increase the bad bacteria, and this creates local as well as systemic inflammation. It causes issues with the gut-brain axis. When you disrupt the gut-brain axis, you can tip into migraines. But on the other end, just by working on your nutrition, good dietary fibers, you can help promote a better gut environment to increase the beneficial bacteria, decrease the bad bacteria. And as a result, right, you get better blood sugar balance, your insulin levels out, you're going to absorb nutrients better, inflammation from pathogens goes down, you're going to decrease localized and systemic inflammation, you're going to ultimately increase how long you live. If that's not a reason long enough, it's not that you just want to live longer, but the quality of life is going to be better than if you don't. So start with nutrition changes and always tell people, like, look, man, supplements are meant to help facilitate a change, but not be the change. And that's where we really went wrong in medicine because of all the drug companies. The push is, hey, here's the medication. It's going to be the magic bullet for you. But they ignore the individual responsibility of what we eat truly does matter. All right, so here's the next one that we're going to look at. The interplay of the diet, gut microbiome, and brain in the pathogenesis of migraine. So ultimately, as we talked about, right, the foods we eat change the composition of our gut bacteria. As it happens, we don't get proper function there, okay? So we're not producing the beneficial stuff we need, our short chain fatty acids. We're not producing the neurotransmitters we should be getting. We shift more inflammatory. This allows not only inflammation in the gut, but also impact the brain. And then as a result, we see this here. Okay. We become more sensitized to pain, ultimately leading to issues. As we talked about, we know with migraines, ultimately you get mitochondrial dysfunction, energy-based issues. So diet is a really, really good way of going about this. So hope that helped a lot. We're not going to go into this part here, but ultimately, I'm going to break down migraine and review with you what we've talked about and add in some stuff that we've not talked about. Because beyond what the research shows, I do find lots of things that are actually beneficial for patients with migraines. Migraine itself, it is a neurological issue, aka brain. Healthy brains all have this in common. Okay, take it to the bank. They do. Healthy brains connect well. They connect well. They also have good mitochondrial function, which we're going to put energy. They produce and use energy well. Next, they have a healthy immune system. There's not unresolved inflammation going on. And lastly, there's a healthy vascular supply. When you get all these boxes checked, migraines are going to disappear. And if they're there still, they're going to be substantially less than they would have been. So, connecting. Well, eye movements. Can't tell you how many people I do eye movements and balance testing, and we see issues there. You can also look at QEEG, which is basically looking at brainwave functionality, which can also tell us what's happening in different parts of the brain. Energy. How do they do with the testing? But also, do they have things ruining their energy? Maybe thyroid, maybe there's anemia issues, maybe there's hormone, maybe there's blood sugar, insulin, and so much more. What about immune? Right? As we talked about in the beginning, when someone has autoimmunity, they have allergies, they have more inflammation, they're more likely to end up with migraines. And as you can see, the list really can be pretty long with this. Maybe they've got an autoimmune disease, maybe they've got issues with mold, maybe they've got that gut bacteria imbalance, that dysbiosis. What if they've got vascular issues with migraines or, damage to their blood vessels? So as you can see, there's a lot of things. And this is why I think so many people, it's easy for them to go and say, like, okay, can you just give me my Nurtec? Can you give me a medication, even if the medication is not perfect and it probably is going to come with baggage down the road? It's because there's not one thing that drives migraines. There's not. If someone tells you there is and they say they've got the magic bullet fix, you should just run because they're full of it. But there is something when we look at migraines, if you work through these, anything that impacts the nervous system can contribute to migraines. So know how your brain's connecting, know about energy production utilization, know where your immune system is, inflammatory markers, and overall vascular health. If you haven't, please follow me and subscribe on YouTube. If you have any questions, let me know. And if there's any things that you would like me to do extended videos on like this in the future, let me know as well. Because at the end of the day, this is for you, it's not for me. So I'm Dr. Zimmerman. I'm licensed as both a doctor of chiropractic and have a diploma in chiropractic neurology, as well as a nurse practitioner. And I help individuals get their health back. I've been doing this since early on in my training, so over 10 years now. And I've seen people that have been everywhere. And it's by stepping outside the regular box that they're able to get the answers they're looking for. So if you're looking for something like that, then feel free to contact me. And until this next one that we put together, this is Dr. Z.